Okay, we're continuing with the book here, Prevent and Reverse Sleep Problems by me, Pete Rogers. This is part 5, rule number 11 to sleep better. Make your bedroom very, very dark, especially in summertime because the sun comes up earlier and you get that sun shining in your face. It wakes you up sooner than you want to be woken up. So make it as dark as you can make it, but you can still find your way to the bathroom safely. Okay, and if you need to, if you're old and you're worried about falling or something, you can put like a railing to guide you, or you could set up your furniture, the tables or whatever it is, to guide yourself to the bathroom. You want to start your night by laying right side down. Here's how the stomach goes. And I know some other people have been told left side down, but left side down is stupid. It's rather obvious. One of the things I do is I was a diagnostic radiologist as well as imaging guided surgeon. I can tell you I've seen hundreds of these things. They're called barium swallows, upper GIs. The patient drinks barium. You lay them on the right side down and whoop, the contrast pools on the right side of the stomach and it drains out rapidly. That's what you want. What you don't want is laying your left side, have it sitting there in the funness of the stomach, and you'll increase your risk of aspiration. Okay? It's pretty obvious. Also, the heart, the apex of the heart is closer to your left chest wall. So if you just lay down on your left side, you might feel your heartbeat against your chest wall a little bit, and that's can bother you and make it harder to sleep. Venous drainage from the brain is variable, but so that one I'm not going to comment on too strongly, but it tends to favor laying on one side or the other, and for most people the right side is preferable. But through the course of the night, you're going to lay on everywhere. You're going to be right side down part of the time, left side down part of the time, on your back part of the time. That's normal, okay? But, it's better to be on your side. You tend to sleep deeper. On your back, you tend to be more prone to waking up and you start thinking and stuff. You don't want to be thinking. You want to be sleeping. Okay, so lay right side down here. I'll show you the next picture, show you what that looks like. So when you lay right side down, whoop, your stomach drains out. That's what you want. Rule number 3, don't be a fat ass, okay? All right, now if you go to a conventional medical doctor, they don't know anything about nutrition. They're going to go, well, it appears that you have sleep apnea. We're going to do a pulmonary sleep study, and then we're going to recommend a CPAP mask for you, continuous positive airway pressure breathing. They'll put this big mask on you, and you look like a dog with a muzzle. All you got to do is eat low-fat vegan, and you'll be skinny. You don't need Ozempic. You don't need another BS. 1 billion out of 1 billion rice eaters, they're all skinny, okay? So stop being a dummy and just eat what skinny people eat, okay? It always works. You just have to give it a little time, and just try it for 3-4 months. It's not the end of the world. Oh, I'm going to eat low-fat plant foods, what all our ancestors have eaten for the last, ever since beginning of recorded history, okay? Why not do that, all right? Do what you want, okay? But if my message doesn't resonate with you, it's your problem, not my problem. It means you're stupid. This has been known for many, many, many thousands of years, okay? You eat low-fat plant foods, you become skinny. That's it. All right. People who got a BMI, body mass index over 30, they're usually at high risk for sleep apnea. In the USA, about 5% of adults are officially diagnosed with sleep apnea, but lots more have it. Some articles claim as many as a third, but those articles often exaggerate stuff because, they want money. They want people coming in for sleep studies to make money off them. The pulmonologists used to make a lot of money off all the smokers, but people aren't smoking anymore, so the lung doctors need something to do. So they did fellowships in sleep medicine. So now they just make money, instead of making money off the skinny smoker chumps that burn out their lungs with emphysema, now they make money off all the fat, stupid chumps with sleep apnea. Okay? It's just how it works. All right. Men tend to get more sleep apnea because they tend to deposit more fat in their tongue and it can seep back, especially if they're prone. If they're supine, and then block their airway a little bit at night when they're sleeping. Women have less fat in their tongues because they talk so much. So they're a little less prone to getting sleep apnea. But after they're postmenopausal, then they get a lot more sleep apnea. Okay. Women love to talk about their feelings. My girlfriend, now she's my wife, she's always asking me, how was your day? Are you happy? I'm like, stop asking me that. I'm a man, okay? A man is busy. We don't think about our feelings. I even told her, I said, don't ever ask me that again. I said, I'm a man of action. I'm not sitting there talking about my feelings. Said, you women, you're like a bunch of cackling birds singing and gossiping all day. We love the sound of your voices, but we can't think the way you do. My son overheard the conversation. He's like, Dad, you really should be more polite. That's it's not very nice the way you talk. And I'm like, look, pal, I know I got more experience with women than you do by decades and decades. And if you act like a wimpy simpy beta male and kiss their butt, they lose respect for you. You just have to tell them the truth and be open about it. It works much better that way. And in reality, I said women are more attracted to alpha males who ignore their petty banter and chatter than they are to beta males who kiss their butt. And then he said, oh, yeah, right, Dad. Is that why Mom divorced you? And I said, shut up. Okay, like I was saying, to lose weight, eat a low-fat, plant-based diet. 1 billion out of 1 billion rice eaters are skinny, and not just because Mao starved them in China. The Koreans are skinny, the Japanese are skinny, the Thailand people are skinny. All the rice eaters are skinny, okay? And when anybody eats that way, they're skinny. It doesn't have to be rice. It could be potatoes. Sweet potato people eating are skinny. The regular potato eating people are skinny. The grain eating people are skinny. Dr. John McDougall, greatest doctor who ever lived, he said, all large, healthy, thin populations since the beginning of recorded history have eaten a starch-based diet. There are no exceptions. There are no exceptions. And as soon as they go west and they start eating high-fat meals with fried food and animal foods and processed food, they blimp out and get fat. So there's the CPAP mask for sleep apnea. It looks like a muzzle on a dog or something crazy. The sleep apnea patients, they get a lot more atrial fibrillation, higher risk of dementia, congestive heart failure, coronary artery disease, etc. All right, I think we'll end it right there for today. I hope you found that helpful.